mynews.studio.
Washington just approved $6 billion for the fight against HIV. The question is, will this actually shift the balance?
For context, it's February 7th, 2026. Congress just greenlit a $6 billion package supporting global HIV and AIDS programs. That's a notable change after months of funding cuts that left health systems scrambling. Can you break down what's actually being funded here?
Definitely. Here's how it breaks down. $4.6 billion goes to direct U.S. support for countries with high HIV rates, mostly through the America First Global Health Strategy. Another $1.25 billion is for the Global Fund, which handles AIDS, tuberculosis, and malaria. Then, $45 million goes to UNAIDS. What stands out is that Congress rejected close to $2 billion in proposed cuts. So this isn't just a renewal, it's a reversal.
Why was this so urgent? What would have happened if the funding didn't come through?
If this funding hadn't been approved, the progress toward what are called the 95-95-95 targets would likely have stalled or even reversed. That means getting 95% of people diagnosed, 95% on treatment, and 95% with viral suppression. We'd already started seeing disruptions, supply chain issues, clinics shutting down, treatment shortages. The most affected were countries relying on U.S. support. All of that put the 2030 goal of ending AIDS as a public health threat at risk.
To get specific, where is the $4.6 billion in direct support actually going? How is it being used on the ground?
The majority goes to countries with the highest HIV burdens, especially in sub-Saharan Africa. The funding covers antiretroviral therapy, HIV diagnostics, and prevention tools like pre-exposure prophylaxis. There are also newer drugs in the mix, like lenacapavir. The aim is to close treatment gaps, get more people diagnosed, more people on treatment, and more people with suppressed viral loads. There's also a shift toward country-led, data-driven programs instead of just direct aid.
And that $1.25 billion for the Global Fund, how does that get distributed?
The Global Fund pools money from a lot of countries, then gives grants to low-income nations for their own HIV, TB, and malaria programs. The U.S. is still the leading donor. This funding keeps clinics open, supplies moving, and prevention programs running in places where national budgets are stretched.
UNAIDS gets $45 million. What does that cover exactly?
UNAIDS coordinates the global HIV response. This funding pays for technical support, collecting and analyzing data, and helping countries design programs that are effective and can stand on their own. It's about making sure resources are used strategically and that progress is tracked accurately.
Looking back, what have we learned from earlier U.S.-led HIV efforts? And why was there concern about sustainability?
Previous U.S. investments saved millions, but they sometimes led to dependency. When funding became unstable, as we saw this past year, countries experienced drug shortages and clinic closures. This new package is meant to support local ownership and resilience. It also blocks cuts that would have affected domestic U.S. programs, like Ryan White and CDC initiatives. So, it's not just about foreign aid.
So, this isn't just about restoring old funding. It's about changing how the money is used?
That's right. There's more focus now on building self-sufficient health systems, technical support, and local management. For instance, there's interest in things like drone delivery for medicines and more private sector involvement. The goal is to create systems that can keep working even if funding changes.
Let's zoom out for a moment. Does this U.S. decision put pressure on other countries to increase their own commitments?
It does. The U.S. is still the main donor to the Global Fund, even though its pledge is a little lower than in past years. Other big donors like the UK, Germany, and Canada have actually reduced their pledges. With this new U.S. package, there's definitely more pressure on them to fill potential gaps and keep progress on track.
Do you think other countries will step up, or will domestic pressures hold them back?
It's a mixed picture. South Africa, for example, is increasing its own funding, tripling it in some cases. Some other countries might take a wait-and-see approach. But the U.S. move sets a clear example. It could influence both governments and private donors as they decide where to allocate resources.
So, to sum up, this isn't just about the money. It's about leadership, building better systems, and long-term planning. Are we likely to see real progress toward the 2030 goal?
That's the intention. If the funding is managed well and countries invest in their own health systems, we could move closer to ending AIDS as a public health threat. But it'll take ongoing coordination, innovation, and commitment, not just from the US, but from the entire global community.
We started with a $6 billion headline, but really, it's about lives saved, stronger systems, and a renewed sense of urgency. Thanks for taking us through all the details.
And thanks for listening. This episode comes to you from mynews.studio. Try it out for free.